Good morning, you're watching Hornbill TV, and today in the newsroom special discussion, we are going to discuss about health. Health, as we define it, is a state of complete physical, mental and social well-being, and not merely the absence of disease and infirmity. It is a basic human right that all individuals of the society deserve. Today, on our special newsroom discussion, we shall discuss how the health infrastructure in Nagaland has developed through the years, with many questions to be pondered upon, like, is our health infrastructure up to mark? Is it enough for our growing state and population? And one of the key issues being how much development has really happened in the remote and far-flung areas of Nagaland. The National Health Policy of 2017 aims to increase government health expenditure to 2.5% of the total GDP, and for states to increase their health spending to at least 8% of their budget. Is it actually happening in our state? And how much is actually being utilized to its full extent? I will be joined by our senior journalist, Al Nguli, to have his outlook on this issue. Hello, Al? Yeah, good morning, and thank you so much for joining us. Hello.
Hello, Lee. Yeah,
Yes.
I can hear you.
Yes. So, Sir Al, the first thing I want to ask is how do you think the health infrastructure of the whole Nagaland is right now? Is it up to mark according to your point of view, or how is it?
No, I think you're asking the wrong person the question in this regard, because I think it will be really great if the state would study and issue yearly data in regard to the state of infrastructure in the state. I do not have the data for 2021-23, the pandemic years, but during my reporting days, especially during the middle 2000s, we were told that the kind of infrastructure in Nagaland, and before we go into this, I want to make this point. All this that we're talking about will be anecdotal, something that is only observed, because we don't have data, we don't have government surveys to say, okay, we have this many buildings that have been built over the past 20 years, 30 years. We have this many buildings to be built again. We need this much of personnel. We need this much of workers. Mm-hmm. So we don't have this data. But okay, to the point again, during the mid-2000s, when I was reporting, we were told that the infrastructure development in Nagaland is one of the fastest in the Northeast, just after Assam. But yes, like I said, these are just hearsay. This could be just propaganda. And we don't know, because if we go to the ground, we most likely will not see the kind of infrastructure that we would expect to see if we compare it to the state outlay. In 2007, I think that state's outlay was about 1,700 crores. Mm-hmm. So during that fiscal year, I think can you hear that?
Yes, sir.
Okay, I think somebody needs to go to the workers to shut them off. So, is it loud in the studio, Lee?
Yes, there's some disturbance.
Yeah.
But it's okay, sir.
Okay.
Go on, please.
Yeah, so in 2007, I think the outlay of the state government in this fiscal year 2007 and 2008 was somewhere in 1,700 crore. So, when you talk of outlay, you're not just talking about a single department. You're talking about multiple sectors of the state, in which each of which the government expects to give a trust link.
Yes.
So it could be the sports infrastructure, it could be administrative infrastructure, it could be medical, it could be agri.
Yes, sir.
So during the time in the 2007 and 2008 era, we were told that although the outlay was one of the highest in the Northeast, just right after Assam and Manipur,
yes, sir,
it was not sufficient to cover the whole developmental vision of the state of Nagaland.
Yes.
So now in 2000 2009 and 2010, if I'm not mistaken, the outlay was increased to I think around almost 2 crores, 2,000 crores, 300 something. So, yes, around 2,300 crores something. So, we were told also during the time that this was also not enough, because during the mid 2000s, big projects such as what you see today,
Yes.
the Dimapur to Kohima National Highway, was starting to form. And there were a lot of stuff going on with the Look East policy also, which was later called the Act East policy.
Yes, sir.
And there was a lot of formulation going on that I think, judging by the sights and sounds and the conversations in the media, said infrastructure is not really part of what the people were expecting to see in the new millennium.
Okay.
And the trust was more towards the more visible sides of infrastructure, that is like roads, drains, culverts. So sometimes, I'm not saying the government, but people in power normally would use visible developmental symbols to indicate there is some kind of a growth in the state.
Yes.
And they will project the impression that, hey, we are doing what you expected us to do. We are your leaders, so we are bringing development, progress, peace, whatever it could be. So they use these visible symbols to tell the people that something is growing. But like I said, we don't have data.
Yes.
And Nagaland is a data nightmare. We have reported this even to like 10, 15 years ago. So if we could have government data in regard to the state of infrastructure, then I think it will give us a very good premise to have conversation. But one thing I know, and like I said, anecdotal, our experience are just observed. Infrastructure in Nagaland generally is not good. That is as much as we can say. If we go to the remote areas, you will see primary health centers.
Yes, sir.
That look like cow sheds.
Sorel, before we go on again with the topic, as you have just touched the topic of the budget, I would like to let the viewers know that the budget allocation for the Department of Health and Family Welfare under the government of Nagaland, in Nagaland, for the year 2024 and 25 is rupees 90,659 crore, which is a 13% increase from the revised estimates for 2023 and 24. And the health and research has been allocated rupees 3,002 crore, which is 4% increase from the estimated expenditure of 2023 and 24. So is it a very good sign and big steps that the government health sector is taking to provide health services to the state?
Well, it's their duty. It is nothing good or bad. It's their duty. Whether they like it or not, they'll have to give, because it's a basic requirement for any welfare state. So it is not like they're doing a good job, or it's not like they're doing a bad job. It's like appreciating the police for enforcing law and order. This is not something that should be lauded or criticized, because this is their job. They are paid to do it. So that aside, I think if the outlay would be in the range of 19,000 crores, did you say?
90,000.
90, oh yeah. So if it is in the range of 90, then I think that's for a state of Nagaland that has about 19 lakhs in population, I think 90 would be something we would expect, that there will be a lot more trust in the health sector, or anywhere. It could be agriculture, horticulture, fishery. So you would expect some kind of a trust. But like I said, and I'll continue to say this, and I always say this, all our experiences will be anecdotal. It will only be observed. Because when we talk of development, I think no matter how many fiscal years we have, because unless we have the statistics, the data, if we could have a government set of numbers that will tell us where exactly the funds are going, which sector and which trust, then I think we will have a clearer picture. Because as long as we don't have data, Lee, there's no way we can form a clear vision. Because when you have data, when you have the numbers, you are able to formulate a policy. And that is why people and governments across the world engage in research and data.
Exactly.
Economic surveys first, before they start using funds, before they start visualizing the vision of their development,
Yes.
before they start forging a way. So it could be 20,000 crores, I don't know, it could be 3 trillion, it could be 90 rupees. We could have any amount of budget or state outlay, but if we don't have data, then it's going to be very difficult. Like I said, I think it was in 2017 or 2018 that my cousin inaugurated a small primary health center. And I think it was in Wokha district in the lower Lotha ranges. So that health center had been lying open like that for practically decades. It looked like a cowshed. So anyway, my cousin and some of the government leaders, they went and inaugurated it. And for that particular village, and I wouldn't say which, it's probably the first proper health institution that's seen in the region for decades. And then if we come to places like Dimapur, or if you go to Kohima, there's no comparison. Of course, it's obvious that we're in the urban areas. We have much better health infrastructure. But if you go a little outside, once you pass the boundary, then the story might be a little different. So that is why we cannot say that, okay, now they're not using their funds, or we don't have good or bad infrastructure, unless we have some kind of an economic survey in place to actually calculate the progress that we have made so far. Only then we will be able to have a conversation. Otherwise, generally, it will be difficult unless we send out reporters every day to the villages to see what infrastructure the villages have. Otherwise, we don't have much.
Yes, sir. Sir Al, now let us try to focus on the rural areas, the remote areas of Nagaland. According to me, I would like to say, like, it will be the eastern region where they are more far flung from the mainland of Nagaland, say Dimapur, Kohima, the centers. So eastern region and all these areas, these are more remote. So what is the current situation of health infrastructure over there? It's not just the government, but what about the private sector health hospitals, the private hospitals also?
It's been some time that I have been to the eastern areas. I have been to Mon also. I've been to Tuin Sang also. So generally, of course, you cannot really compare the remote regions of the state to more urbanized areas such as Mochong or Kohima or Dimapur. I think that will be improper. But comparatively, of course, the regions that are far from these urban areas, they have substandard infrastructure. But then again, I would also say here that the kind of infrastructure they have, and if we're talking of qualitative infrastructure, Lee, then I would suggest it will be more or less the same across the state of Nagaland. Okay, Mon, you cannot really talk about Mon and their infrastructure there because mostly they won't have much. Even Tuin Sang, but I'm telling you, have you ever been to Wokha, Lee?
Yes, sir, many times.
But have you ever been and lived to the villages?
Not the interior
then
part.
You should.
Yes.
Have you ever been to the villages in Mohoshong?
Yes, sir.
And have you lived there?
Yes.
Have you ever been to the villages in Newland areas?
No.
You should. And this is the reason I say this. I am not saying things are developed in the eastern regions. And I'm also not saying that it's better off in Wokha, Moshong or Kohima, the villages, the fringe areas. But if you go to the villages, you will see that the roads are as worse as the ones that you can see in the Tuin Sang or Mon areas.
Yes.
And I'm from Mokotso village in Wokha district. I am telling you, you have not really seen the kind of villages they have there in the lower Lotha areas. They don't even have roads, forget electricity, forget water supply, forget medical health institutions. And these are so-called advanced people, forward people. So there might be disparities, and there might of course be overlapping developmental narratives between the eastern regions and the others, central Nagar areas such as Kohima, Mochong or Dimapur.
Yes.
But if you look at the rural conditions, if you look at the infrastructure in the rural areas across the state, I'm telling you, it will be the same. It will be the same. They still have road problems. They don't have doctors in the primary health centers.
Yes.
They don't have nurses. I don't think we can make a comparison in that regard.
Okay. So Al, when you were talking about data, let me highlight this thing to our viewers, that the Health and Family Welfare Department of Nagaland, it has an official website where even I recently checked, and it gives us all the details of all the CMOs, all the government district hospitals. So right now we have a little bit of data at hand. Like for example, in Nagaland right now we have 12 district hospitals, but only 2 TB hospitals. One is in Mokokchung, one is in Kohima. And on top of that, as you were speaking of Monos as well, in Mon we have 90 government health centers right now, which includes all the sub-centers, CHCs, primary health centers. So including all this, is the, let us say, like what would you say that is government slowly progressing? Right now even the NHAK Kohima District Hospital, it's also is going ahead by leaps and bounds. It's making new buildings, it has now new ICUs, big beds. But is it enough to cater to all the people, and especially people from the remote areas? Do they always have to come to the big hospitals? What about the district hospitals in their own districts?
2 points here. That is not data, first thing. Those are only infrastructural verticals. What they are saying today is that we have got 12 district hospitals. Well, I can tell you about 20 years ago that we had about 11, which is not because there is progress, but because every time you create a district, you are required and mandated to instate a district hospital. So that is not growth, and that is not data also. We have about 335, if I'm not mistaken, primary or community health centers for about 2 million people in the state of Nagaland. We have about 12 district hospitals, and these are mandate institutions, because whether there are people or not, once you create a district or a subdivision, you have to create at least one institution, whether you provide medical services or not, for instance.
Yes.
So that's not data. Data is just like you said, second point, just like you said, whether is it enough for the people? Is it enough that we can do with 12 district hospitals? Is it enough that only about 355 primary health centers across more than 1,000 villages in Nagaland will be sufficient for the people? Are there personnel in each of these institutions? And what is the kind of services that they are providing that the villagers will most likely spend more money to come to Dimapur or go to Mochong or Kohima for medical treatment? And what is the economic outcome or the economic pressure on the villagers? What is the level of attrition for people seeking medical help? And what is the impact on their economy? Or what is the impact on the local economy? So that is what I'm talking about. We need data that does not point to physical things. We need data that will give us some kind of a vision for us to go forward, clarifying the flaws, clearing the flows, and filling the gaps. And that is the reason why I see, that's the reason why I am saying we need data that will help us to formulate some kind of a policy. And I think if we go to even here, the Nagaland Medical College that was in September approved, and they had commenced their academic session. And Nagaland Medical College started almost after 10 years of being approved, Lee.
Yes.
And it goes all the way to 2014. And after a lot of delays and revision of estimates and the cost, and a lot of controversy, court cases, allegations, a lot of mess was created. And thankfully for now, the academic session has started, and it started in 2023 September.
Yes.
And I think they're still going on. But I'm telling you, Lee,
Yes.
I have read reports that they don't have Wi-Fi even in this college, medical college. And Nagaland is perhaps the last state in India to have a medical college of its own. The last state. For a long time it did not have its own medical college. And now that we have, instead of talking about medical infrastructure elsewhere, I think we should start at home, right in the kitchen. And the students, I think I read a report where they said there's no Wi-Fi, and there are some basic amenities that are still missing. And of course, the medical college is still in progress. They have not completed the entire infrastructure building yet, but I think they will slowly get all the facilities that it will be needing. But my point is, there are a lot of stuff to do everywhere. It's not just in the rural areas.
Exactly.
Even in Dimapur itself, and many people, especially the Eastern people, no disrespect, but you look at Dimapur or Kohima and say we are advanced or this is forward, we are discriminated. But the truth is, we haven't traveled across the state of Nagaland, especially in the villages,
Yes.
to be able to look at development from a very objective level. Everything is subjective. Oh, Mauchong, they are so advanced, but they're not taking care of the other regions. You know, Kohima so advanced, they have everything, but they don't care of other. But what we are seeing, development in its form in Nagaland, Lee,
Yes.
is symbolized only by Dimapur and Kohima. Everywhere it is totally messed up.
Sir Al, it has come to light through some of my sources that in some remote areas, some remote villages, though the government is willing to set up a CHC or a primary health center or even a sub-center, it has come to light that sometimes the villagers, they refrain, they say no to the government, they don't give any land, they don't give any space for the government to set up that kind of health center. Whereas in some other places where the villagers are willing to give land to the government, but it does not come out under the list of the government's like annual plan. So what message can we give to the people to enable them to learn, to get to know, be educated, and know that health is one of the most important things for them? And when there's a new project or a scheme or anything that will uplift their medical infrastructure in the village or in their area, how do we let them know that that this is the right thing to do?
Yes, land acquisition is one of the biggest problems in the way of Nagaland developing, Ali.
Yes.
And it's not just in the health department, it's not just about health infrastructure. It is everywhere when it comes to development. Roads, for instance, for many years, the Dimapur to Kohima highway had suffered from a lot of controversies regarding to land ownership, acquisition issues. And even in the villages, it's not just with roads, it is with even setting up electricity poles. So here the communities, we cannot really blame them in the sense that what do you have in the villages? You know, they don't have an economy of their own. Somehow there will be people who want to capitalize on development. So you have questions of land prices, land ownership, and people who want to capitalize on that. So land ownership and land acquisition issues is something I think the government has been struggling ever since the birth of Nagaland way back 63.
Yes.
So it's not just in one sector, one area, one village or a town. It's across Nagaland because the land holding system in Nagaland is extremely unique. It is like in nowhere else. it is difficult for the tribal people to just give away land like that unless they are going to get something in return. So it's not that they don't like, okay, we don't like health, so don't come. We don't like doctors, so don't come. I think it's nothing like that. I think the issue is different.
Yes.
If I think they would
Very
be
well
given a
stated.
very good deal instead of a raw deal where the government just takes the land and just set up something and then forgets it, then I think the villagers will not be willing to part with land.
Very well
because
stated. Yes.
there are a lot of villages and schools across Nagaland from Mon to Dimapur where they have had schools but no students.
Yes.
And there are schools that have no teachers and headmasters. It's everywhere.
Yes, exactly.
So if you want to set up a medical institution in the village, the villages, they will want to make sure that they have a doctor or a medical personnel there. So there's no point for you giving your land to the government when the government will not build anything for you, or you won't get nurses or doctors there. So you have to get something in return. So it is not just the health department, it's everywhere. The road and development department, you have the PHED, PWD, even the power department. They have to go to the landowners. They have a meeting, council meeting, to just decide where to put an electricity post. That's what we are doing there right now in our neighborhood. We wanted to put up an electricity post, and this guy did not agree. This one agreed. This one said no. This one said he did not want it on his land, and we said we don't want it on our land, that electricity post. So we called the entire community for one electricity post, Lee.
Yes,
that's the kind of problems that we have. It's not just with the medical department, it's everywhere. So I think what we need to do is at a community level, draw up some kind of a vision document for themselves, a practical one, and something that is not necessarily leaning too much towards give us this, give us that, we are going to take that. It's more to do with community. So just give the government a little bit leeway also.
Sarel, I hate to interrupt you, but we are running out of time. And this has been a very good discussion and a very lengthy one indeed, because there's so much more to speak about on this topic. But hopefully, one day again soon, we shall bring this topic to light again for our viewers. Thank you so much for joining with us.
Thank you.
So this is all we have for now. For the latest news and updates, you keep watching Hornbill TV.